Hello there. I hope everybody's having a great day and showing your smiles out there. Um, just working on a case. I wanted to kind of show you what we got going on and just kind of share the process that this patient, the journey this patient is on. So she came in for a cosmetic consult. She didn't like her smile. We talked about her cosmetic options, which is very, very important. I think you see different things out there and you think, well, that's what I need. You should really go in there and see what option you have and understand the pros and cons, the positives and the negatives, and there is to every treatment. So we discussed those with this patient. We talked about tooth movement, Invisalign, veneers, bonding, whitening, and so what we came up with her, what was best fit for her, and it's a personal thing because her smile could be best with veneers, but if she's not ready for the financial commitment, the time commitment, doesn't like the idea of the process, whatever it may be, that may not be what's best for her. So the issues that we're facing with her case, that she has the uneven edges to her teeth. Ideally, we want to see the edges follow the smile line. So if this is her lip, you want those to be in harmony and symmetry. So when you have this edge going here, 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 that's asymmetric. It's not in harmony. When we look at a smile, it's not going to look nice. So we have full face pictures, but we'll put the lip line here, and we want that to kind of parallel or match that. Additionally, the color of her teeth are a concern for her. She liked them brighter. Okay. The teeth have different profiles, meaning everything should kind of look as if it was pointing toward your belly button. So this tooth is, if we draw a line here, this is kind of going this way, this way, this is a little sharp going that way, this is this way. So we want everything to be, again, in harmony, not perfection. There is no perfection in smiles nor in life, which I think we've all learned a hard way or just by being taught. But it's symmetry and harmony is what we're looking for. Also, there's a little bit of a what we call black triangle here, which is a space where there's no gums that is visible to her. You can't really tell in these pictures because they're two-dimensional, but there's some rotation to the teeth. Whenever there's alignment issues, we always bring up to patients about moving the teeth because it is addressing things at a foundational level. For her, because she had orthodontics in the past and she had some shortening of her roots as a result, which can happen with orthodontics, it's not advisable for her to go through further orthodontics. So we ruled that out as something that wouldn't be beneficial to her to put more force on the teeth and potentially cause more root resorption and not having the teeth be anchored in the bone, which is important. Veneers would be a nice option for her because we have full control of the smile. We can do them pretty conservatively in terms of the alteration to the tooth structure. So that is something I would recommend. Sometimes I don't recommend that because I don't think it is necessary to achieve the cosmetic outcome, nor would it could be super aggressive or just not necessary. But in her case, she would do very well with veneers. She did not like the idea of veneers, so we moved towards bonding. So bonding is directly placing composite filling material to the teeth. The pro of bonding is that it's a conservative process. You're not altering, or you're altering the teeth very little, because you are just you're more adding to them. A downside is you can't change the whole color of the teeth. You can't change the whole shape of the teeth. You can, but not predictably. And it's technically not as strong. Porcelain is stronger than which your veneers are made of. is stronger than a resin, which is kind of a filled plastic, but they can still last a long time. It's very technically sensitive in how it's done, because it's very adhesive dentistry. So you really have to bond well. If they're not bonded well, things will chip. So that's kind of the treatment process we went through. So right now I am waxing, what we call waxing up her case. So I'm looking at her teeth. I've also had her smiles. I don't have them up for her privacy. And I've physically added wax to her teeth to make them more ideal. And what this is doing is guiding the process. So I could just go straight to her mouth and start adding filling material, but it would be very unpredictable, and the outcome wouldn't be as good. So I'm seeing what we want to do in a very controlled setting. I have my models, my pictures. So now, if you look at the edges, we've evened those out. That's gonna match her lip line. We have everything looking like it's going towards the belly button. Everything's going inward. We will close up that space in her mouth. And I can have a lab do this, but I like to do this myself, because I kind of like to massage the case. So I spend some time with the case before I go to the mouth. So I've already, this case, her case is, and her smile is in my mind. It's already, I've already practiced it with my hands. So I will now make a mold of this, and I think you've seen in some other videos of us doing this as we transfer this to the mouth. We'll make a mold of this to act as a guide and a stent. So we will then put the filling material in that mold and transfer to the mouth, and then put my final touches on it in the mouth, which helps mimic what I've done here. So I think her case is coming up. We'll show you that process. But again, it's really important for us, for our patients, and just the general public, to be informed and to understand when you're trying to enhance your smile, what are your options, and what are the pros and cons of this option, and what is best for you. So we're going to be doing these bondings for her. I think she's going to be very, very happy. It's important that it's done with a lot of skill, because there's good bonding, there's bad bonding, there's good veneers, there's bad veneers. It's not the material or the technique itself. It's matching up the right material and technique for the patient, and then executing it well, which takes a lot of time and practice and skill. So try to inform yourself, reach out to us, reach out to your doctor, look online. And so it's really important, because I love when patients come in and they're educating themselves, and we have a really good conversation, and I can really dial in what we want to do with that smile. So, and if they haven't, educate themselves, that's also my job. So yeah, excited to do this case. We'll keep you posted when we actually do the bonding. Take care.